Hi everyone! Today I'll be discussing the medication known as Naproxen. Before jumping into further details, let me briefly explain about this drug. Naproxen is a non-steroidal anti-inflammatory drug which is a common drug used by public specifically for mild pain or moderate pain. Generally, naproxen helps reduce hormones that cause inflammation and pain in the body. Some of the examples that naproxen treats are rheumatoid arthritis, ankylosing spondylitis, bursitis, gout, menstrual cramps, acute pain, musculoskeletal pain, and osteoarthritis. It's available as a tablet as well as suspension. In the tablet form, it's available as 250 mg, 375 mg, and 500 mg. Now, these tablets can be non-enteric coated, so just a regular tablet, or they can be enteric coated, so sometimes you'll see an EC on the prescription vial that does stands for enteric coated, which basically means it's a little bit easier on your stomach. Now, there are some precautions that must be taken when this medication is prescribed or even purchased over the counter. So, I'll share some of these precautions with you now. It should be used cautiously in patients who have ischemic heart disease, such as heart attack, a history of heart attack, as well as chest pain, as well as a history of cerebral vascular disease, so this would be a stroke. Also, NSAIDs such as naproxen can promote sodium retention through a mechanism associated with your kidneys. So, this could be a problem in people who have heart failure as well as people who have increased blood pressure. Lastly, I would like to mention that debilitated patients may handle side effects less well, so for these individuals, the rule of thumb is usually to use the lowest possible effective dose for the shortest amount of time possible. Moving down from precautions to contraindications or reasons individuals would not be able to use naproxen. It should not be used in the third trimester of pregnancy, people who have severe uncontrolled heart failure, have active ulcer or bleeding in the GIT, have inflammatory bowel disease, have liver impairment or active liver disease, or have severe kidney impairment. The typical dosing that we do see is anywhere from 250 to 500 mg taken twice daily. Now, this medication can be taken with or without food. However, the recommendation is usually to take it after a meal because this helps make it easier in your stomach. It's also important to realize that naproxen isn't a type of medication that's going to treat an active disease. It usually just treats symptoms such as the pain and swelling that you may be experiencing. It's also important to note that this medication only relieves symptoms such as pain and decreases inflammation as long as you're actually taking the medication. So, if you're trying to relieve your symptoms or decrease swelling, it's important to use it consistently. Now, while this medication is being used, there are some side effects and individuals may experience both the course of therapy. All the side effects I'm going to mention now seem to happen at a rate of 3% to 9%. This includes in terms of your gastrointestinal tract, heartburn, constipation, abdominal pain, as well as nausea might occur. In terms of your central nervous system, headache, dizziness, and drowsiness can sometimes happen. Moving on to your cardiovascular system, some people may experience difficulty breathing, while others experience peripheral edema. Last but not least, some people may experience tinnitus, as well as, interestingly, an increase in thirst. The route of administration is orally with food, milk, antacids, preferably aluminium and magnesium hydroxide containing antacids, proton pump inhibitors, and misoprostol. This is to decrease incidence of gastrointestinal adverse effects. On a side note, naproxen sodium is more readily available than naproxen because it has demonstrated faster absorption. The pharmacokinetics of naproxen is that it is rapidly and completely absorbed from the gastrointestinal tract with an in vivo bioavailability of 95%. The elimination half-life of naproxen ranges from 12 to 17 hours. Steady-state levels of naproxen are reached in 4 to 5 days. Before explaining in further details about the mechanism of action of naproxen, let us talk about what happens during inflammatory response. During tissue injury or irritation, the phospholipase enzyme A2 is released. It converts phospholipids in the cell membrane into arachidonic acid. Arachidonic acid is the substrate for two major enzymes that are cyclooxygenase and 5-lipoxygenase. But for now, we're going to be focusing on cyclooxygenase pathway. Cyclooxygenase enzyme exists in different forms, two of which are cyclooxygenase 1 and cyclooxygenase 2. Cyclooxygenase 1 isoform is expressed constantly throughout the body. Its primary function is to produce thromboxane and prostaglandins, which stimulates normal body function. A few of the examples are the secretion of protective gastric mucus, regulation of gastric acid, promotion of platelet aggregation, and the maintenance of renal blood flow. Cyclooxygenase 2 is not expressed constantly in most tissues, but instead it is induced at sites of inflammation. Unlike cyclooxygenase 1, cyclooxygenase 2-derived prostaglandins mediate mainly inflammation, pain, and fever. Now, coming into the mechanism of action of naproxen. Naproxen acts primarily by inhibiting cyclooxygenase enzymes. It leads to decreased production of prostaglandin, and as a result, it produces anti-inflammatory, antipyretic, and analgesic effects. So now let's move on to the pharmacodynamics of the naproxen. Based on their selectivity for cyclooxygenase enzymes, NSAIDs can be divided into three broad categories. Number 1, selective cyclooxygenase 1 inhibitors, non-selective cyclooxygenase inhibitors, and selective cyclooxygenase 2 inhibitors. This selectivity for cyclooxygenase enzymes explains some of the differences in efficacy and safety of these NSAIDs. In our case, naproxen falls under non-selective cyclooxygenase inhibitors. The most common adverse effect of naproxen occurs in the GI tract, where cyclooxygenase 1 mediated production of prostaglandin E2 and prostacyclin, which plays important role in synthesis of protective mucus and regulating normal gastric blood flow. Hence, the inhibition of cyclooxygenase 1 increases risk for gastrointestinal bleeding and peptic ulcers. We have finally reached the end of this discussion. Thank you so much for listening till the very end.